Chris Frederick with the Collaborative Care Collective, and I'm very excited to be with one of our speakers for this year's summit and conference, Professor Max Paquette, PhD. Greetings and welcome, Max.
Yeah, thanks. Thanks for having me, Chris. I'm really excited about this and then the conference as well in June.
Yes, thank you. Well, can you give us, the listeners, just a little bio of what do you do?
Yeah. So I'm a professor in the College of Health Science at the University of Memphis. Specifically, my research and advising roles with grad students and teaching are focused on biomechanics and sports science, or just sort of broadly sports science, including biomechanics, physiology, anatomy. So I've sort of been involved in research that spans the whole sports science gamut, including clinical work with collaborators that are scientists and also clinicians over the last 15 years. And my research has primarily been focused out of my own personal interest, to be honest, on running, biomechanics and injuries and footwear design and things like that. So that's been my primary professional sort of background. And then I've been a runner my whole life. I ran collegiately in Canada at the University of Guelph, and I've been coaching for a long time, high school and adult and professional runners. So it's been a huge part of my life, running has.
Excellent. I'm even more excited to hear about your bio. So the topic, my understanding is from ground contact to joint load,
Mhm.
biomechanics of different foot strike patterns and footwear implications.
Mhm.
So what are you excited about to share about this topic with that would interest regenerative physicians, physiotherapists, physical therapists, and other allied health professionals? That's the whole essence of this summit,
Yeah.
this conference. It's a collaboration of different
Right.
professions, and so
Yeah.
go for it.
Yeah. So like I said, because my background has been like sort of quite diverse in terms of who I work with, coaches, other sports scientists, clinicians. I'm really excited to have the opportunity to present to this group, especially with the interactive sort of approach to health. And so I think the topic of strike pattern in runners, sort of how your foot hits the ground, is such a popular one, and there's always really good questions about that, and some myths and misunderstandings, of course, as most topics, but I think really kind of diving into it and talking about and sharing information about how strike patterns affect lower limb biomechanics and muscle demands and lower limb joint loading, and then also like I mentioned, perhaps debunking some myths that are out there about strike patterns in runners. Um, and then with that, definitely sharing how shoes and different shoe types specifically and specific and also shoe features, right? In terms of shoe construct, how those might interact with strike pattern and then affect, like I said, lower limb biomechanics before. So I think, shoes, especially these days, like going back to the early 70s, early 80s, shoes were pretty consistently built. Now it's just kind of chaos out there. There's no clear sort of
Mhm.
direction with shoes, it seems. And so there's lots of features of shoes that, depending on how you strike the ground, they'll affect your body differently, like the type of foam, the curvature of the sole, the weight, all these different things play a role. So it'll be interesting to dive into that as well. So in terms of like practical applications there's quite a bit about, in terms of footwear selection from that standpoint, for everyday runs and runners that want to just start and get new shoes, but also from a clinical rehab standpoint, in particular in terms of like running or return to running programs, especially when, during those return to run programs, managing lower limb loads are pretty important, especially if it's a specific tissue or area. You can then think about shoes and strike pattern and how, depending on your strike pattern, what shoes might alleviate or attenuate some of the loads wherever the injury might be or the pain might be. So it can also be a nice strategy for clinicians to use shoes to mitigate those loads during a return to run program. So that'll be fun to share with everyone at the conference.
Yeah, a lot of fun. I'm real excited to hear that, and I can't wait for you to attend your lecture. Let's move into exactly what you started talking about: medical conditions, pain. What if you want to just call it pain? It could be
Hmm.
any number of things.
Yeah.
I was thinking about this. So, has any research that you or your colleagues have done show evidence of either causation or correlation between specific foot strike and or footwear patterns, and then specific issues in the low back, in the hip, all the way down the low extremity to the foot.
Hmm. Yeah, it's that's like kind of like the meat of this topic, right? Like what how you move obviously affects how forces are sort of transferred in different parts of the body. And so if you change how you run, for example, your strike pattern, if you know run more on your toes or on your heels or your midfoot, that shifts where the loads go. And that'll be a big part of the introduction to that presentation is like explaining how that happens first. And then from that, then you can figure out, well, of course, those that maybe have Achilles tendinopathies and things like that, uh, you know, though we know that running on your forefoot or toes really increases the amount of like demands, force demands on plantar flexors, your calves, and whatnot. So there's so many good examples of that, right? Depending on strike pattern, running on your knee, on your heel, you know, increases the load of the knee, for example. So there's always ways to kind of think about this problem mechanically, and the amount of research done on this since 2000 and I'll say now 2006, seven is kind of when the foot strike sort of topic became really important or more common. There's probably been 400 or 500 articles that have been published on this topic. So there's tons of information. Some of it, as you said, is more correlative or more cross-sectional, comparing different groups and kind of seeing how they compare biomechanically. There have been a few longitudinal prospective studies to try to understand more causation. The evidence there is a bit more sort of murky just because of the nature of running and different types of runners and shoes and so on and so forth. But those will be some topics that I'll definitely dive into sort of in the middle towards the end of the presentation. So hopefully we can kind of, you know, break it all apart and decipher what's good and what's bad.
I think all of us as practitioners, from physicians to all the other professions I mentioned, have seen runners at one time or another, some of us more than others. A lot of us actually have a special interest in the running population. And so
Mhm.
we're really excited to hear about about that,
Yeah, perfect.
the
Yeah,
breakdown.
running, you know, running is always such a popular topic. Like any sports science, biomech, sports medicine conference you go to, there's always at least a few sessions on running specifically, right? So whether it's running injuries or shoes or just running in general, and so yeah, it's there's so many people that do it, right? So it's that's why it's an important topic to study and understand. So I'm glad, you know, a lot of clinicians are on board there.
Awesome. Last question would be, is it what's the proper term? A biomechanist,
Yeah,
or is it
biomechanist. Yep, yep.
okay? So
Biomechanist. Yeah.
all right. So let's say a practitioner, physician, physical therapist, allied health, working with a client, patient,
Hmm.
client, and we're hitting a wall. We hit a plateau. Maybe
Hmm.
we made a little progress, maybe not.
Yeah.
When is the right time, you know, so we don't waste the patient's time and we don't drag it on too long?
Yeah.
When is the right time to bring in a referral to a clinical biomechanist?
No. Yeah. Great question. I think I think it depends on like the context, of course, but I would say assuming that the clinician has gathered good information about the training for the person, and maybe as that conversation with the coach or coaches, and perhaps that you know possible training errors or overloading, overtraining have been ruled out. Let's say, because often injuries that we see in runners, there's like the really elite level runners, right? Like the Olympians, top of the top of the top. Those athletes, they're always pushing the limit, so they're going to get hurt at some point. It's just kind of inevitable, right? At the same time, they're also the cream of the crop. So in terms of like biomechanics and strength and all those things, they're typically a bit different. They're kind of anomalies and unicorns in that. Like they typically run well, however we want to define it. And so those are kind of different than like the average person who's starting to run or have been running for a number of years and all of a sudden they get pain or develop some overuse injury or something like that. Then I think the first step is diving into training, you know, load and what they've been doing in training. And then if we can rule out that everything seems to be, you know, been done safely and progressively, then I think is when we kind of can dive into like the clinical biomech or gait analyses and really understand, are there some particular movement patterns that might be sort of raising red flags, and then maybe some other anatomical issues, of course. But I think that's really when I think once you rule out certain things like clinical, like anatomical clinical issues or training errors, then you can kind of dive into the biomech. Because I've seen people who, I don't want to say they run badly, but for lack of a better term, I wouldn't say they don't have proper running form, if you will. Like they just look like maybe, oh, they could use some work, but they've never been injured, right? And so, and then I've seen runners who look like they're just, wow, what they look like they're, just bouncing around and they look really great and efficient and smooth, yet they're always injured. So it's a difficult problem because there's so many factors. And I will also in the talk sort of discuss like the interaction of like, biomechanical factors, training factors, and other things that play a role in injury development and how biomechanics fits in and when it fits in. So I think it'll fit right into this question and these interests for clinicians.
Well, that's great. We haven't had anyone like you speak yet. It's our third
Yeah,
annual convention. So we're all really excited to have you. And I want to thank you for your time today. Really
yeah, of course.
appreciate you.
Yeah.
Again, it's collaborativecarecollective.com for anyone interested.